Hello, this is Dr. Maria Marzo, and today I'm going to talk to you about periodontal disease, the stages of periodontal disease. Periodontal starts with the prefix peri, which means around. So like peripheral vision, perimeter all mean around something. Periodontal means around the teeth. So that's referring to the gum and the bones. And we're going to use these drawings, which are courtesy of the Oral-B company, to go through the stages. In this picture, you see the condition healthy teeth and gums. And in the drawing, you see a tooth, the bone, and then the pink gum. This little tool is called a periodontal probe. We'll just call it a ruler. It measures the small space called a pocket. And in a healthy teeth and gum situation, that pocket should be 3 millimeters or less. So we measure it because that gives us an idea of how tightly attached the gum is to the tooth and also the gum attached to the bone. When people don't brush well for a while or for whatever reasons, the gums get inflamed and that leads to gingivitis. In gingivitis, going forward with these pictures, you're going to see the affected side with that condition on the right, but the healthy side on the left. So on the left, you see light pink and the bone is up to here. This peak creamy color is the bone. But on the right, you see the inflamed gum. The tool goes in a little bit more and the gum is red. They tend to bleed. So people who come in and say, my gums are bleeding, they usually have gingivitis as long as their bone is still healthy and in the same position as a healthy patient. Now, if that condition is allowed to go on for a long time, the toxins and bacteria that live in that deeper pocket that forms harbor in there, make more bacteria, and they start to destroy the bone. And that'll be the beginning of periodontal disease. Gingivitis is totally reversible, just needs a good cleaning. Whether it's a regular cleaning or a deep cleaning, that's all it needs, and the gums can go back to normal. So gingivitis is fully reversible. As I mentioned earlier, if gingivitis is not taken care of, it then leads to periodontitis, another word for periodontal disease. Now you look at the affected side compared to the healthy side. In the affected side, you see the bone is down to here versus the healthy side, the bone was here. So there's been some bone loss. These brown areas are the way of depicting tartar. Tartar or calculus, it's like a stone formation that forms around the teeth and under the gums. Now you see the gum is more inflamed and more detached. So that space called the pocket is deeper. And we know that by measuring our little ruler, the perio probe goes in further. The tartar underneath continues the inflammation. So the treatment for this is to get that tartar out of there. It's a more involved cleaning than the person with gingivitis. It's a deep cleaning. We usually get the patient numb, and it should be done with anesthetic so that we can do a thorough job, get that tartar out, and by getting that tartar out, we can arrest or stop the periodontal disease from getting worse. But this is not reversible. Once there's bone loss, it's not the same as gingivitis. So whenever possible, we want to get to patients per condition when it's at the gingivitis state, and hopefully the patient comes to the dentist early enough before they lose bone. At this point, it's mild bone loss, so it's called early periodontitis. If that's allowed to continue, again, more bacteria, toxins living in that deeper pocket destroy the bone even more. Little by little, you see more gum recession, deeper pockets, and the deeper the pocket, bacteria love that. The more they can live inside that pocket and cause more damage. So again, on the left is the healthy side, and on the right you see where the bone level is at now. And this is called moderate periodontitis. If this is allowed to go even more, then it can lead to advanced periodontitis. Now you see how low the bone is, and if that bone is that low all the way around the tooth will be loose, and that'll lead to the loss of teeth. So what's the treatment? Scaling and root cleaning, the removal of the tartar hopefully before it gets to this stage. Now, sometimes patients will come in and say, I haven't been to the dentist in many years and I'm ready to get my teeth fixed. And we're happy for them that they want to address their teeth. That's what we're here for. And they'll say, I want to fix the teeth, but I don't want to do the deep cleaning, a layman's term for scaling and root planing. Scaling and root planing is the procedure of getting the tartar out, again, done under local anesthetic so you don't feel anything and so we can do a good, thorough job. After the scaling and root planing, the gums are pink, tight, and then it's up to the patient with our recommendations on brushing and coming in for cleanings more often to keep that healthy pink gum environment. But patients sometimes, all they want to do is fix their teeth. Well, I want you to think about this. It would be as if you wanted to build a house and you said to the contractor, I want to build a house, and you point to quicksand, or it's a swamp, or you say, but I want to use this wood, it's the cheapest wood, and there's termites in that wood. The termites in the wood would be analogous to the bacteria that's in the pockets. No dentist should be doing dentistry on top of tartar, on top of inflamed gums, bleeding gums. It just won't last. It's not the right thing to do. So I hope you understand the importance of getting treatment for the gums in preparation for the dentistry that you're looking forward to having. It won't work otherwise. We cannot do good dentistry leaving the periodontal condition to continue to deteriorate. It just won't work. Thank you.